The National Collaborative for Health Equity invites you to listen to part one of a two-part conversation about food justice and sovereignty.
Hi, everybody. My name is Treasure Shepherd. I am a project manager with the Housing Authority of the City of Los Angeles. I work in making sure that the quality of life for residents within Los Angeles under affordable housing programs and at public housing sites has a quality of life and a sense of pride that everyone deserves.
Hi, I'm MB or Mary Beth Mitcham. I work for George Mason University. I'm an assistant professor there and the director of their online Master of Public Health program. And in my spare time, I do a lot of community work related to food accessibility.
So, MB, I know that you are a director of the online MPH program at the George Mason University, and I wanted to know, how did you determine that that was the best way for you to make impact on health equity?
So I don't know if it's the best way, but it was one way for me to try to make a difference. Most of my adult career has been spent in nonprofit settings. And what I realized in those settings was a lot of the information that I was experiencing while I was also completing my education at the same time didn't necessarily match the education I was receiving. So I wanted to make sure that I, as a professor, as anyone in academia, could influence the next generation of public health leaders by incorporating real world examples, experiential learning opportunities, which are chances where students can learn by doing, into the classroom so that they didn't just read about social justice, they didn't read about health equity, they didn't hear about it in a lecture, but they were able to apply it to what they learned so that hopefully they could go and do some amazing work themselves. So, Treasure, I've been hearing some amazing work that you've been doing in LA when we've been chatting about it. Also, the fact that you recently became Dr. Shepherd. Can you please share a little bit about your background, your educational journey, and why you fell in love with the work that you're doing now?
Yes, I think it's best to start with my educational journey. So initially, I was an aerospace engineering major and knew I wanted to do that since I was 7 years old. By the time I reached my junior year in college, though, I was faced with a lot of racism, sexism, ageism, and just realized I didn't want to have to deal with that for the next 40 years of my career, and decided I wanted to get into anti racism education. And in trying to enter into the education policy space, I recognized very quickly that the babies that I was trying to teach anti-racism to would not be able to pay attention or really sustain, retain any of the information I was giving them because they were hungry. If your belly is grumbling, you really don't care what the teacher is saying. You're not going to keep that information and pass it along years later. And so then that's how I got into health policy and really looking into food access. Same with medical care and public health. And in getting into that health policy space, I realized it really doesn't matter how much free food we give people or free medication if there is no safe place for them to store it or stay. If they don't have a home that has electricity, that has gas in order for them to cook the food, then we're really doing a disservice by just giving them one piece of the puzzle and not the entire plan, right? And so that's how I got into the housing space. That's where I'm at now. I've been in housing specifically with the government for almost 10 years now and love it. And so currently I'm working as a strategic initiatives project manager for the Housing Authority of the City of LA, really focusing on quality of life projects. So I'm over all the green space projects, so parks, community gardens, some kitchen incubator workforce development programs. We're really trying to touch on all aspects of life that improve health equity and quality of life. So I love it because it allowed me to still address the anti-racism, but from this other very innovative way, right? The way that nobody really thinks of. We can have tons of people working on that, and I'm helping and doing my part by making sure that the people they're teaching are housed well and have access to the things they need. So, what freedoms come from being in a space where you get to educate leaders of the future?
I think the thing that I love the most is being able to see my students' eyes light up when they learn something new and they realize they've already applied it in their life. So a lot of our students come from underprivileged backgrounds. Many are immigrants themselves. Many are first gen. Many come from multiple cultures, multiple backgrounds, and they've never thought of diversity in those contexts before. They've never really considered what it means to come from an area and to have limitations because of where you come from. We see this a lot in public health. We refer to them as social determinants of health, but something as simple as a neighborhood in which you grow up can determine what food you have accessible to you, where you get your education, where you have your health care. So, getting our students to understand that their background is shaped by their experiences has been eye opening. But it also having the freedom to do that in a creative way to spark their interest to see how they can use that information to make a change in somebody else's life has been liberating. So having students do things like volunteering for soup kitchens or volunteering for homeless shelters or going and talking with people who are impacted by all of these adverse health conditions and then seeing them put the pieces together in their own minds and then hearing from them afterwards that they're doing the same work that we talked about in class to make a difference has been, I think, the best part of that freedom is seeing something coming out of it. Can you please share a little bit more about the community garden work that you've been doing? It sounds very interesting.
Yes, I'd love to. So I currently have 4 community gardens that I've been working on and 1 farm. And the farm project started about, well, actually, yeah, all of them have started about 5 years ago, when we got some really great funding, about $30 million to kind of match the efforts we were doing with rebuilding the housing project, Jordan Downs in Los Angeles. And so there are 3 community gardens that are on public housing sites and are providing access, both to land and fresh foods to residents that do not own their own land, right? So that's one of the options that we have. And being able to see, um, it's so fulfilling to see grandparents kind of show their kids, how they've utilized plants when they were younger, especially before technology and like processed foods and packaging, right? Um, Being able for Black grandparents to teach their kids, like, this is what a collard green looks like. This is what it looks like before you see it on Thanksgiving, right? And to be able to see the Latino parents and grandparents teach their youngings about salsa and like, this is what the jalapeno pepper looks like. This is what the hatch looks like, and create these very beautiful, delectable cuisines from something that looks like a tree or something that the kids are like, ew, that's a vegetable, but they don't realize that they eat vegetables all the time and it tastes amazing when abuelita makes it or when Nana makes it. And showing them like the connection, the connecting the dots of that, like to see the kids' face light up is beautiful. So that's what we're doing in the housing project sites. But then I have one at a middle school, and that has like a horticulture teacher connected to it there, and we have like an arborist program where kids can kind of graduate into that space and learn a trade, by the time they're done with high school or right after, and really enter into this beautiful space that a lot of people have been exiting just because they're getting older and people are not really valuing the environmental justice and what it really means to have people of color knowing this wealth of knowledge. So just sparking an interest in things that kids who you know are in an urban city like Los Angeles, around concrete buildings, not really knowing how close they are to green space and food access and the kind of power that's in their hands. So that's a beautiful thing. Lastly, one of the farms that we have poured a lot of funding into and capacity building into is Mudtown Farms in Watts, and to see like to visit when the pineapple tree is like blooming is beautiful. To see them pick the apples from the orchard or look at the grapes and like recognize like we have grapes, we have a vineyard in Watts, that babies have access to. It's not that somebody's making money off of, it's that they get to choose. Parents get to come there when they need to and pick fresh produce and not have to pay for that. Life changing. So beautiful, fun. I just love to be a part of that process. As a researcher and collaborator, working in this space of food justice, where have you identified spaces for innovative solutions, or even identify like challenges in food justice, in places that others haven't?
I think one of the components to that that makes my perspective a little bit different is the fact that I've had my own lived experiences with food insecurity. My mom's heritage included an indigenous background, and that comes with a whole host of potential inequity situations because of all that we know related to historic repression of identity and a devaluation of human dignity and a displacement of people from their land. In addition to that, I also grew up in a food insecure home where our family was not part of any sort of SNAP benefit program. We were not allowed to receive any sort of food assistance, which meant that there were times where we legitimately went hungry. So there were some skills that I learned as a child: resilience of being able to do things like forage when you're hungry. You'll look pretty much anywhere for food, but what can you eat that won't make you more sick or that will be able to help fill your belly? Learned how to cook from scratch. My mom was amazing at taking things that could have killed us. Again, I think now as somebody who's in public health nutrition and all of the food safety things and all of the rusty dented cans that we had food from, and thank God we didn't die from botulism or anything like that. But my mom would take things from what my sister referred to as a pity poor food box, and then she would be able to make meals out of that. She never used recipes. She just looked at what she had on hand and then cooked that. I also looked at things like preservation, working for farmers in exchange for crops, learning how to cook those, learning how to value carrots if that's all you have to eat, learning how to preserve them and being grateful for the carrots, even though that's all you have to eat. And then also understanding that hunger doesn't equate with stupidity, it doesn't equate with laziness, it does not equate with ignorance. That there are many people in food justice space who know these things, but policymakers and people outside of that sphere may not understand that and think that people who don't have food are lazy or that they're making poor choices if they do have food, but they're making unhealthy food choices, things that don't help their chronic health conditions. And not understanding that for children in particular, they don't have a choice. They eat what their parents provide for them. They eat what their caregivers provide for them. For adults, a lot of their food decisions may be based on things like culture. It may be based on things like emotion. We know, or at least I know, that when I'm sad or when I'm angry or when I'm stressed, there are certain types of foods that I crave. They may or may not be healthy, but when you're living in conditions where there's chronic stress, where that acute stress builds up into chronic stress when you're in a survival mentality, then what you choose for food, if you have access to it, may not be what your doctor recommends. So, all of these things I really feel are very important to consider when doing any sort of community work, any sort of collaborative work, or any work at all in the space. Remembering that human dignity is most important. And unless you understand where somebody's coming from, you don't know all of the factors that go into their decisions. So take some time to learn from them.
Oh, I love like remove all the judgment, really just focus on the needs and the culture, right? Because there's some things that are directly connected to our culture. I know me and you talked about slavery and like how my ancestors were forced to make the best of what was given to them, the scraps, so that they could survive and live for centuries. And then, I could be here in 2025 being able to choose my food, right? But still, collard greens taste good, but those were the scraps that the masters didn't want, right? And so, kind of figuring out how to make healthier versions, maybe that comes with the education, but also the access. So, I love everything you said.
Well, and the accessibility portion too. So making sure that people have access to food like you have in your community gardens, making sure people have access to food in neighborhoods, in grocery stores that may not be overpriced, but also understanding that at the end of the day, food sovereignty means that there needs to be sovereignty in the people making that choice and making sure that community has what it needs. So, when we're considering the concepts of community building and collaboration, what are some strategies that you found are effective to help kind of push the answer back to the community? Not having say, okay, well, you have this problem, but knowing that the community may have what it needs to be able to make its own decisions.
Oh, I love that question. Thank you. Get to give me some space to nerd out. I would say so. Remember, I have this organizational leadership background as far as like education and expertise, if you will call it that. Also, to your point, the lived experience is really where it's at. And so recognizing that everything you said is true. Some people don't have these choices. They're making the best with what they're given, and recognizing that that's happening in the individual level, on like this granular level of like family unit and then community wide, right? So in Watts, there is a food swamp versus a food desert. So there's access to food, but it's not the best nutritionally. And then when you're thinking of like meso level, maybe like municipalities or organizations within a particular geographic region, a lot of the food that they're, or not food, a lot of the funding that they're getting is based on the incomes of the people in that area. So like this cycle of oppression continues to happen. So maybe they're not getting a lot of funding in Watts, maybe the same way that Pasadena or Beverly Hills is getting in the same county, right? And just recognizing that one, so like having the ability to acknowledge truth and not, debate whether or not someone's reality is actually fact. And then really for me, capacity building has been the thing that stood out. I recognize in doing a lot of my research within these various communities, Los Angeles, County, Southern California overall, that there are a lot of individuals who don't have these fancy titles like you and I maybe, but have a lot of influence. So like Craig at the barbershop is the guy you go to when you need a good fresh slab of meat because he knows the butcher really well and can get that for you at a good price, right? Versus like, I don't know, Miss Lottie is the person you go to when you need fresh produce because she has a garden and she doesn't mind sharing that. And she doesn't need you to explain your situation. You don't have to feel less than in order to get what you need for the week. So recognizing that there's already people in the community doing that work, and then as an organization and trying to maybe provide additional funding into that space or fight for rights and policy in that space to make it better for those leaders, recognizing that we may be limited, the organization may be limited, the municipality may be limited, identifying those gaps, kind of doing this risk assessment, seeing where maybe duplicative efforts are being poured into and then we're missing other areas when we could really be spreading that wealth and making sure that everyone's covered. So those are the sorts of things I found in my research activities. And I utilize community-based participatory action research as a method for anything around food justice and food sovereignty, because you're really bringing in these people as your co-researchers. You're no longer like looking at them as specimens. No one wants to feel like a lab rat. So making sure that they feel as though they have complete control over the research with that, which that method allows for them to do. And so they're telling you what they need. You're listening to them. The only thing that you're bringing as far as expertise is maybe systems, like recognizing I know this, but you're letting them also tell you, hey, I know that legally it's supposed to be this way, but maybe in Watts they don't treat us that way. That's not how our city council really works, right? And believing them and then saying, okay, well, let's figure out a workaround so that you can still have your voice heard, because your voice can be heard. I can show you, I can educate you on the things I know, you can educate me on the things you know, and then we can figure out how to empower and embolden these community members to be able to make the choices, to your point earlier, for themselves, so they can have actual sovereignty, not just a bunch of cans dropped off every week, right? But like maybe they don't eat canned food. Maybe this is a kosher community that just doesn't have the economic ability, right, to choose those things that they want. Maybe I'm trying to think of another group. Like I know the Islam community, some don't eat pork, right? So recognizing like somebody dropping off pork, even though it's free, is not going to go very far in that particular community. So recognizing who you have in that space and letting them make the decisions for themselves. You only get to do that when you have actual open, free dialogue and trust. So those are the things I suggest: capacity building, trust, communication.
I love that.
To learn more, look for part 2 on our website, nationalcollaborative.org/hope in action.